wanted to know whether they think it's right or wrong for Medicare to require beneficiaries living with early Alzheimer's to participate in clinical research as a condition of coverage for FDA-approved medicines. And what would people think if they had to pay more in health insurance? Would they do that in order to get better access?
9 in 10 say Medicare should immediately cover the costs of FDA-approved Alzheimer's drugs and therapies the same way they do medications for other diseases. This is a completely bipartisan issue. Every single demographic and political group is wildly in favor of this. And frankly, this in a polarized America, you just don't see numbers like this.
The strong support is because this disease is so personal to many Americans. They've seen firsthand the debilitating and personal nature of this disease, how it strips loved ones of their memories, their personalities, and their sense of self. And they see a need to address this. Voters agree the drug should be provided without requiring the prescribing physician and patient to participate in clinical research as a condition of coverage. And by 69 to 19, a majority of Americans strongly favor it. It's overwhelming.
92% of voters agree that Medicare should provide all beneficiaries access to FDA-approved Alzheimer's jobs, just as they do to FDA-approved drugs for all other diseases. 78 strongly. Again, people cannot understand why this isn't the role now. As Neil has said, this is personal, this is urgent, and people support the policies even when the rubber meets the road of being told it would cost them more.
This is a disease where 2,000 or more people are dying of this disease every day and want the additional time with families that these drugs can offer and want the ability at a much less expensive and more accessible means to get blood tests for it. So I am 100% understand what Celinda and Neil are telling us. The patient community we represent is in pain and wants the insurance that they bargained for.